Welcome to Speech Scope, a MedBridge podcast where we conquer challenging topics for the medical SLP. Our aim is to deliver actionable takeaways for clinicians like you through captivating discussions with experts in our field. To receive continuing education credit for this episode and access bonus resources, make sure to check out medbridge.com. Hello, I'm your host, Sarah Baar, a clinical SLP in Michigan with over 15 years of experience. I specialize in adult neurogenic disorders and the life participation approach. Today, I'm excited to be joined by Dr. Tabia Pope, an expert in the area of athlete brain health and sports concussion management. We'll be diving deeper into this topic, including recent research and actionable takeaways you can implement right away. Welcome, Dr. Pope. Can you get us started by telling us a little bit more about yourself?
Thank you so much, Sarah, for having me on Speech Scope today. I am a 3-time alumna of Howard University's Department of Communication Science and Disorders in DC. I specialize in traumatic brain injury, specifically with sports concussion management. I also have background in neuropsychology and health communications. I balance my time between being a clinical instructor of speech pathology and being the president and CEO of Head to Speech Incorporated. So I spend also a lot of my time working with also athletic trainers, making sure that speech pathologists are not left out of the conversation when it comes to athlete brain health.
Awesome. I am so excited to unpack this conversation a little bit more. Let's start by, why don't you tell me a little bit about your journey and how you initially got attracted to concussion care, or maybe how that passion evolved over time?
Yes, thank you so much for that question, because this sports concussion management and concussion management in general is really personal. It's a personal connection. My own concussion history, having sustained 2 concussions in my youth, and really understanding the return to learning process, and which I really love the advocacy part of in functional treatment for everyday, things that we take for granted, and how brain injury impacts us in our everyday life. And specifically with my connection with sports, I'm a sports wife as well as a sports mom. So when I was in my master's program, thinking about how I was going to connect my love for brain injury and how I was going to do more research, I chose my community. I chose the sports community to really understand how it was impacting specifically football players at the time, because I believe that 70% of African Americans play football, and so it was impacting specifically my community. And I started around 2014 doing this work. So it's been almost a decade of research, putting my heart and soul in understanding the issues of athletes.
That's awesome.
Thank you.
I love to hear, it's interesting how our personal experiences can impact us, beyond just personal, but professional. And I look forward, as our discussion unfolds, to hear more about your Head to Speech organization and kind of where that journey led you. So Today we decided to focus our conversation about concussion care for adults with sports-related injuries. And I want to hear from you, why is this an important conversation? And is there anything we should start out with, like, questioning as clinicians?
Well, I do want to, when we think about adults, I want to think about the population that often usually gets overlooked in maybe speech pathology, right? It's the collegiate to young adults to adults that are functioning when we talk about brain injury or mild cognitive impairment, right? So that population in sports, I started off researching collegiate sports and athletes in that area. I started to connect with athletic trainers, introducing myself, integrating myself into sports, because it's one thing to be in an outpatient clinic or be on the outside, but I found that I had to integrate into athletics. So I even go and call myself a certified sports SLP now because I'm within athletics. I work within athletics. And so when I think about the adult population, I explore it from retired athletes as well. So I look at collegiate athletes and then professional athletes and then retired athletes. And that population that I talk to, they need more education and understanding the role of a speech language pathologist. Their connection usually to speech pathology is in schools, right? Or in thinking of strokes and thinking of more of the acute phases, right, that we think about. But how can we help them at a more functional level with mild cognitive impairment or early dementia as we're seeing those cognitive changes from repetitive brain trauma, from sports concussions. And so my work is also tied to Black Men's Brain Health Conference during Super Bowl week, where this is my research, where I talk about my research and I connect with others in this space for brain health. And the adult population, it is our goal to make sure that we also are connecting and working alongside athletic trainers and physical therapists and other independent neurotrauma specialists, and letting them know that we have a role in how they're missing out, right, on not having that referral system with us, right? How we need to be integrated into their toolbox. Essentially, athletic trainers, facilitate concussion management. And so it's at a disservice if this population of collegiate athletes, professional athletes, and retired athletes don't know how to access us or are accessing our care when it's kind of too late, And I'm like, we can do a lot of preventative education. And that's what Head to Speech is about being proactive, not reactive, and how we can, implement these things. I also talk about, we focus on the 1.6%, say, in football that go on to maybe the NFL, right? That go on to the NFL. But there is a population, 98%, that of football players that are going on to the NFL. So they may not have the same resources that are afforded to someone maybe in an NFL. And so they need education and they need resources. And so we're trying to really bridge that gap with the educational resources, the integration with our education and our awareness and our training.
Wow, that's awesome. I'm hearing you say several of the problems. So it's not only that our actual clients don't understand what we do here, but also maybe our the coworkers or potential coworkers, like the athletic trainers. And so you're kind of targeting it from multiple levels.
Yes.
To make sure that our role is understood.
Yeah, interprofessional education and collaboration. And I don't think we talk about that enough. And I think that framework is new to maybe both professions, speech pathology and athletic trainers. And that's what the research shows, right? It's like we need to go through that framework together, learn from each other, learn about our roles, and that we're not competing with each other, right? Mm-hmm. There's a role, athletic trainers have a role in concussion management, but speech pathologists also have a role in return to learning. And I would even say with return to playing, helping to integrate cognitive tasks into that return to play protocol, right? Cool. So dual tasking is known to us through, working in rehab settings where we may have work with the PT and OT and speech are there, right? Mm-hmm. So that concept is not new to us. But the concept, it can be new to us in the sports arena, mm-hmm. right? Of what that looks like in sports.
Yeah, I've never thought of that before because we do like to keep things really separate where mm-hmm. we're like, oh, we're just talking about return to play. Mm-hmm. Or, oh, we're just talking about return to learn. Mm-hmm. But really, like what you're saying is we could be really looking at the whole picture for these clients.
Oh yeah, you have to. Sports concussion management is definitely interprofessional. I think what the research is saying, right? So what the research is saying is that our athletic trainers usually work obviously with team physicians and physical therapists. Like they're most comfortable with that with those professions. I would even say psychologists, so sports psychologists, nutritionists, like those are the other professionals that, they want to work with, or other professionals. But when we look at speech pathology, the research is saying that SLPs, there's differences in collaboration were found between practice settings. So interprofessional education and collaboration we are also in the same vicinity as athletic trainers when it comes to school-based sports is in the schools, right? our youngest athletes, you think about our youngest athletes. And so, and also healthcare, right? So the collegiate setting in healthcare. And so we are in close proximity to athletic trainers. And so it's actually a no-brainer for us to be collaborating with athletic trainers. I think it's the way that we talk about it and the way that we understand each other's role to be able to facilitate that interprofessional education and collaboration. So that's what the research is saying, is that that SLPs, even though maybe athletic trainers don't understand our role, but SLPs, more of the research is coming out that SLPs want to connect with athletic trainers. Like we want to be part of, especially the return to academics, right? Where you see an athlete, they go through return to play protocols, and then they may go back on the field. But then what happens when they return to learning? And learning actually happens on and off the field, because the athlete has to learn their plays. They have to adapt and adapt to their academic schedule. They're balancing both their athletic and academic schedules. So if you're an athletic trainer and you're responsible for 30 athletes, you may be responsible for 3 teams, right? That's a lot of athletes that can slip through the cracks. If you don't have someone that can help to facilitate that return to learning process that a SLP can help you with, then how many athletes are slipping through the cracks that we're not helping, that we're not getting them accommodations, and that we're not educating to be able to say, hey, you may have post-concussion syndrome. You may be putting your brain at further risk because you're not reporting, or that, because of these issues, you want your playing time. You may be going back into the game too early. I also say that speech pathologists, we are a conscience to the sports community. We bring that conscience, right? And so it really is tapping into the culture of sports and how we can shift the culture. And that's what I'm trying to do.
I love that. Tell me more about why you say that speech pathologists are the conscience for sports. I think that's really interesting.
Yeah, I've heard it from psychologists, sports psychologists, and those that work in counseling as well, because they're also deemed as being conscious as well, because they're working one-on-one with athletes, right? And they're learning about the mindfulness, and they're integrating that. They're integrating counseling techniques and strategies. And that's essentially what speech pathologists need to kind of move towards when it comes to brain health coaching in this space, and how we can talk to athletic trainers about how we can be that conscious, and how we can really provide a more independent, I would say, independent reality to what's happening with the athlete.
Yeah. Like you kind of picture the athletic trainer as being maybe like the central hub. So they're kind of like that first level. So this is why that interprofessional kind of collaboration is so important, because they're almost like the gateway of like, okay, here's an athlete with a concussion, and here I'm going to plug them in or refer them to the different services. And where we can kind of complement each other is like we both may recognize that there is difficulty with returning to learn, but what we get to do in speech therapy is more of that like personalized support, where the athletic trainer can recognize like they're not really providing those like one-to-one strategies as much. So we really support each other. We can see the same problem but bring our different lenses of expertise. Is that kind of how you're like viewing this?
Of course, that is. So that communication has to be there. There has to be a coordinated care, right? There has to be that communication, that collaboration. And I would even say interprofessional education is near to my heart because I believe that it starts when you're a student. How we're training the next generation, right? Now that the sports community has come to terms with concussion, right?
Yeah.
Now we've come to terms with, hey, we need return to play protocols. Hey, we need return to learning protocols. We've come to terms with that. But are those protocols really in place? You may have return to play, but do you truly have a return to learning protocol that is in place with a referral system that works, right? And so if we're training the next generation to do this, it starts with collegiate, really building that, building at the collegiate level with programs that have the infrastructure. I always say the infrastructure, right?
Yeah.
Because we have programs on collegiate campuses that do have that infrastructure. They have athletic training programs, they have speech pathology programs, they have kinesiology, they have everything, sports management. But I asked them, is everybody communicating? How are we training our students to go through this process so when they do become professionals, they already know what a speech pathologist's role is, right? We capture them earlier than later.
That's awesome. So this might be like just like a tag team question here about interprofessional education.
Yeah.
I know that you published research in 2019, and I wondered if you wanted to share a little bit about what you looked at and what you found.
Oh, yes. So thank you for that because my dissertation was on the role of speech language pathologists in academic concussion management, sports concussions and the effects on cognitive communication skills in African American college football student athletes. I know, a long title. Dissertations usually have a long title. but
You gotta be specific, right?
But I did a 3-manuscript dissertation, and the first part was really going in to the athletic community and using questionnaires and focus groups to talk to coaches, talk to athletic trainers, talk to athletic administrators, right? Because you mentioned earlier how the athletic trainers are the hub, but they're also influenced by athletic administrators, right? So if athletic administrators don't understand the culture of why the athletic trainer needs SLP in their toolbox, then there's going to be something, there's going to be a disconnect there. So going in and learning the community is important. And so when I think about interprofessional education, I learned that there are different ways that you can set up interprofessional education. It can be through emergency situations, so a pre-event medical timeout experience where, you're utilizing emergency preparedness, basically, and you're doing this with speech pathology students, athletic training students. You're doing this with all of the physicians. You may be doing this with nursing. So that who's involved in that emergency situation. So you're preparing for that. I would say this at the high school level, there's a shortage of athletic trainers as well. And so speech pathologists at the high school level have really a great opportunity there to support athletic trainers in that area and really in the emergency situations, because they don't have the type of services or resources that the collegiate level has, or the professional level has, right? So that area there is important for interprofessional education. You also have pre-professional collaboration models that I talked about earlier with the students. Case-based learning is also important. You may be going through a case together, learning about each other's roles, the communication, the assessment, the treatment. And then there are programs out there that are joint concussion management programs. And those programs were at the forefront of, I would say, this movement that we now have, of speech pathologists working with athletic trainers, working in sports concussion management, where those initial joint concussion management programs that we've seen in the research.
So that's kind of like, you would see that as the gold standard, or like what would be great to move to is multiple professionals have a seat at the table or a say to do the concussion management.
Of course, having a functional collaboration model, right, where everyone has their role, but just similar to if you're at a rehab center first, you have those team meetings. You all come together and talk about your patients, right?
Yes.
And you meet with those professionals. It has to be just like.
This sounds amazing. I'm just flashing through the concussion clients that I've had along the way and how bumpy and prolonged sometimes the care can be. And I can just imagine that if from the get-go they had the right professionals around the table, what a better experience and outcomes that could result. Just like practically thinking, where, like, I'm trying to think of the employment type of setting. So when there's these joint concussion management programs where maybe athletic trainers and speech pathologists and other rehab professionals might be together, is that like through a rehab system? Or is a university, like collegiate sports, like hiring that? Or what are you seeing for like how it's actually, like how people are getting hired to be on that?
A lot of the research is in high school and collegiate athletics. Okay. So what we know so far is that it does work in the collegiate and high school level. More of the research is at the collegiate level, because you have, I say that some of the college campuses have the most resources that you ever have in your lifetime. And you didn't really realize the resources that you have on a college campus until you leave and you become an adult. And you're like, I missed out on that opportunity. I had all of that, all these things there for me, right? And so at the collegiate level, there's so much opportunity at the collegiate level. But it is the way that we talk about brain health and concussion in our role as speech pathologists that makes the difference. It's how we change the culture and how we talk to the athletic administrators, how we have that top-down buy-in, because you can't do anything without buy-in. So you can't just go into a space without doing some education, some awareness, right? And that's why I founded Head to Speech, because it started off as an awareness campaign of just how we talk about this issue, right? How do we break the stigma around, one, mental health, because, there's a stigma around mental health. And what I say is, if we talk about brain health and the things that cognitive communication, the early signs that we see from brain health, I'm hoping that we address it earlier, it decreases mental health issues, right? But a lot of the focus in sports is very much reactive. And really, I would say even athletic trainers, they are working with athletes that are injured. right?
Yeah.
So they're working with the athletes that they're seeing are injured, and they're trying to get them through their injury process. But it starts before that. You have to educate everyone to get them in tune with their brain and their body before they even get to you. So it's you do these exercises, cognitive exercises before prehabilitation, before rehabilitation, right?
Yeah.
So you have to have that. And I would say the workforce, um, utilizing the same concepts that we have in rehabilitation to help the movement along with the prehabilitation, the prehabilitation.
Yeah.
Yeah.
Awesome. Okay, we are going to try to take some of these ideas and put it in the clinical flow here. So
Yes.
let's talk about if we can just kind of walk through like the assessment time. What kind of information, and you can take this in whatever direction you want, either from the speech pathologist or from the athletic trainer, like what kind of information are we needing to get at the time of the assessment?
So I'm really excited about the SCAT-6. This is a new assessment that has now come out where some of the changes are now it includes dual tasking. So that focuses on the motor task and the cognitive tasks that are done simultaneously. And so the SCAT-6 is used with the athletic trainer uses it to help with concussion management, right? Um, we know that the impact testing and their other sway, there are other resources now, more than before, that help with concussion administration that are given to the team for baseline testing, right? So baseline testing, and you need baseline, right? You need that data, but from the speech pathologist perspective is I'm like, where's the baseline data on return to learning, the academic, cognitive communication areas that are impacted academic wise, right? What
Yeah.
do we know about athletes and their baseline? What can you tell me about this athlete? How were they academically before they had their concussion? How many concussions have they had? And the research shows that if you have 3 or more concussions, then you're more likely to have more cognitive communication deficits. You're more likely to have post-concussion syndrome. So I want to know where the athlete is in their concussion recovery, right? And do we have a baseline? And that goes with the prehabilitation,
Yeah.
because you need pre-injury education and pre-injury data to support what you're doing is even working.
Yeah.
So when we're looking at and one resource that I really love that's in speech pathology that I believe that every athletic trainer needs to have in their toolbox is the cognitive communication checklist for acquired brain injury.
Yes.
Right?
Like Sheila McDonald.
Right.
Fantastic. Mm-hmm.
It's a basic tool that's easy to use that you can look at as an athletic trainer. If you have an athlete that's having difficulty with learning and checking off the areas of cognitive communication that they're having difficulties with, and you actually have a reliable tool that you can hand off to a speech pathologist and say, these are the areas that my athlete's having difficulty with. I need you to take over the care. That is simple.
That is simple. And it feels doable. That's just like a nice, I think it's either just like 1 or 2 pages and it's in patient friendly language and it links to kind of
It's in
what.
different languages too. The thing is, it's translated in different languages, right?
Yes.
So it's multicultural, and it's evidence based, right? So that I would say that is similar to a symptom checklist that athletic trainers would use. That is what a symptom checklist will look like for us.
Now, you talked about taking data just to know like that what we're doing is being impactful. What type of info do you like to use for outcomes or like maybe for goal setting, that type of thing?
Um, well, it's helpful when you're able to work one-on-one with the athlete, and you're able to provide them with a full assessment battery. I think what's often that we don't look into is receptive and expressive language. Auditory processing is another area that we don't look into more. And if you're an athletic trainer, you're like, what is auditory processing? Well, auditory processing is when the athlete can't discriminate words or sounds and background noise. And so if you have an athlete that's going into the game and they're trying to listen to the play, they're getting the first half of the word or first half of the sentence, and they don't get the last half, then they may not be able to utilize that strategy. They may have to now look at symbols, hand signals, to really understand the play. And so I talked to my coaches and asked them, well, how do you address your athletes' learning styles? Because we all have different learning styles. Some of us are auditory, kinesthetic, visual learners. So understanding all of this information is important for baseline data, but it's also important to be able to write reports, impact statements, to be able to monitor the athlete. Because learning, like I said, learning happens on and off the field. So if you're not in tune with your athlete's learning style, then you could be yelling at them all day, but that athlete is not auditorily picking up what you're saying. They need visuals. They need hands-on, right? So we can't expect our athletes to learn the way that we learn. I say love, just like love languages, we have to understand their learning language, right?
It's wonderful. How do you see, so there's treatment trends, and I feel like, probably in the 10 years you've been working on head to speech, you've seen our profession of speech pathology make improvements with knowing what we're supposed to do in treatment for those post-concussion. I know when I started, we were, giving people the advice of being in the quiet, dark room, that type of thing. So now we've learned and we give different types of advice. So I wondered if you could just spend a few minutes talking about the treatment trends that you're noticing going on right now that are impacting a therapy session, or maybe things we need to still improve upon.
I think that is spot on. Of treatment is not going in a dark room. One of the things that I've seen is one of the treatment trends is actually focusing on the athlete coming off of their phone, off of the computer, and during that concussion recovery time, so like 3 weeks, 21 days, is important to actually provide them with things to do during that time that's not on the phone, that's not on the computer. One of the strategies is using voice assistive technology. So utilizing their smartphones, right? Utilizing the things that they have, but utilizing Alexa, Siri to help program their phone reminders, right? Memory reminders, helping them write their even using AI, also helping them write their papers. So they may not need to be typing, but they can use their voice to actually write and help them with their learning, right? So utilizing technology is definitely a big trend now when it comes to how we can assist athletes during that concussion management phase, recovery phase. I would say that also the gaps are, it goes back to collaboration, because if we're not collaborating, then we're not truly integrating cognitive tasks into the athlete's normal routine. And there's so many missed moments when it comes to in warm-ups and athletes doing things that they're not truly focused because it's so robotic in a way that they do things over and over and over, so they're not being as intentional or focused. And so we use mindfulness also as another area that we can connect memory and mindfulness as a way to be intentional with integrating into the athlete's normal routine.
Wonderful. I know you also used the term like prehab. I'd love to hear you talk a little bit more about that, because I don't think I've really been exposed to that much in the world of concussion care. And like, what does that look like in your ideal world, even if it's not totally happening yet?
Well, it's happening. It's happening. It's just not being taught, right? And I think that when in athletic trainers, injury prevention is also important for athletic trainers because, like I said, they're working on the injury. So even athletic trainers need information on prehabilitation. And the dual tasking that coaches and trainers can use, and how speech pathologists can facilitate that. So prehabilitation is really just the notion of working on a skill free of injury, right? So you're building that muscle, right, before it's broken, right? So if something does happen, then that muscle is going to be a lot tougher, right? When something does happen to it, it's going to be more resilient. There is neuroplasticity as well when we talk about our brain. So if there are connections in our brain, like our axons, right? We're doing cognitive activity. We're actually trying to reconnect those neurons, to help with neuroplasticity.
Yes.
So it's the same principles that athletic trainers need to apply to muscles.
Yes.
Right? That speech pathologists need to apply to the brain with neuroplasticity.
Yeah, it reminds me completely of working with I'm kind of more in the space of working with people who are aging. And so we're talking about building cognitive reserve, right? How you need to, before any problems happen, you want to have a really robust neuron network. So if there's a problem with some of those neurons, you have other ones that are strong and good. And I've just never thought of that before for the pre-concussion clients. That's really a
in the younger population, right? So that when we talk about adults, we have to not forget about the younger population. We're thinking about the aging population, but what can we do for the younger population before that even gets to that point, right?
Very good. Okay, a new question here. Obviously, the idea about interprofessional collaboration, that's come up. And how do you suggest that speech pathologists or even athletic trainers who are listening who don't yet have a network like that, do you have any words of advice for how to start that? So it could be like talking points or word choices, or how do you actually go about educating people maybe about the speech pathologist role? Because it is a culture shift, as you mentioned, and that's hard to do.
Yes. Well, that is what I do at Head to Speech. That is all about what I do at Head to Speech and what we do as a community. We are a nonprofit organization that is at the forefront of really closing the gap between athletic trainers and athletics, not even just athletic trainers, but athletics and communication science and disorders, right? Because it takes everybody. When I told you it's a top-down approach, it really is in sports, right? You have to have that buy-in. And so we have a system where we actually go through a framework that has been proven to work. Our last summit that we had brought together a lot of interprofessionals, and they left with a sense of that they could do it, that how to do it, and how they can utilize us as a resource. I think that it's important to learn about prehabilitation. That is important. I think that we need to start, like I said, at the collegiate level with programs doing interprofessional education. That mindset shift is important. If this is going to work. I think on both sides, athletics and communication sciences and disorders, we need to get this information to everybody so we can integrate and increase referrals. Because the research is showing that we're just not getting the referrals.
Yeah.
Right. So
Patients
that means
getting needed services.
right.
Yeah.
There is a population that is untapped, that's unserved,
Yeah.
that has been neglected. And it's, and so now with the retired professional athletes, they may not have that information. And so now we're having to work not only with cognitive issues, deficits, but also the mental health. You're having to kind of work with also the physical injuries that they have. And so the longer you wait to get the information, the longer you wait to work with a speech pathologist, the outcomes, decrease. We want more favorable outcomes, right? We want athletes to have longevity. When I talk about longevity of your brain, you only get one. And so that is the most, if you don't think of anything else, you want to have your brain intact because your brain controls everything you do. Right. And so we have to educate from that perspective of you want longevity, you want a long life, we want you to live long, we want you to, be able to have this next career. Right. And so if you aren't talking about career transitioning, if you're not applying some of those principles to career transitioning as well, then we're leaving people behind and not supporting them as they transition.
Wonderful. This has been a super interesting conversation.
Thank
We've
you.
covered several different things. So just thinking about maximum impact from our discussion, what would be your top 3 actionable takeaways that you'd like the listeners to put into practice?
Oh, that's a good one. I think the first one would be mindset shift. The importance of interprofessional education and collaboration. Like look it up, learn what it means to be collaborative. What it means, it doesn't take anything away from you and your profession. It actually enhances everyone. It enhances your profession, enhances what you do. You make more sound decisions. And who really is impacted is the athlete because they get the best care earlier, right, than later. So that mindset shift is important. And then just defining the roles, like knowing that we have differences, knowing that we have similarities, but bringing our full expertise to the needs that are out there. That is important. And then integration, increasing those referrals. So we have to be able to integrate to be able to increase referrals, because if people don't know about our profession and how it relates to athletics, then we're going to continue to not miss the athletic population. And I would say at Head to Speech, we help you understand the terminology, because the sports world is a totally different animal that you have to learn. And so that's why, I have really focused on what does it mean to be a certified sports SLP, because working within athletics is going to be different than being on the outside.
Yes. Awesome. Great advice. I thought we could really apply this for the audience by talking through a hypothetical case scenario, if you're up for it.
Yes, I think I want to focus on the collaboration piece because I think that that's what we want to really hone in on. So your student athlete is a collegiate football player who has sustained a sports concussion during his sophomore year. So we know that sports-related concussions impact learning on and off the field. So then he may have persistent headache, inability to have good sleep, dizziness, increased sensitivity to light and noise, in the immediate environment, difficulty concentrating, impaired short-term recall. So all of these factors have to be taken into account with his educational accommodations. So when we think of going back, the symptoms with cognitive activities, going back to learning, we have to think of the cognitive exertion that is needed to go back into to be able to learn, right? And so cognitive exertion describes the imbalance of brain injury disruption in the aftermath of sports-related concussions. So instead of allowing the brain time to recover, undue to exertion through a shift return to learning and cognitive activities may prevent the brain from utilizing energy to repair itself. We also have to think about cognitive rest. And so that's the concept of taking a step back from the rigorous cognitive activity in order to provide the brain with dedicated recovery time. So those two areas, cognitive exertion and cognitive rest, are very important when it comes to not only concussion recovery, but return to learning. Mm-hmm. So we see this athlete, right, this football player, and he has those signs and symptoms. And so we're seeing that we need to address these accommodations that they need on and off the field. So the athletic trainer consults with the SLP to determine which activities pose greater difficulty than others do, right? Because the athletic trainer may not be able to really determine the learning outcomes, but we may be able to. And so some of the guidelines that come from the CDC that I would use with this athlete, with this football player, are really thinking about class. I would say the next actions that I would take, right, to address these would be after building a tolerance to increase cognitive demands, the student athlete can progress in a stepwise fashion to partial school days and then to full school days. So just like with return to learning, there's that stepwise protocol. It's the same for return to learning, but taking into account the cognitive exertion and the cognitive rest. Also utilizing individualized approach to determine academic accommodations. So we know that concussions are different for every athlete. So this athlete, the way that we treat his learning academic accommodations might be different from another athlete. So understanding the duration and severity of the symptoms that he's having, the mechanism of injury and consequences of the sports-related concussion are all going to be different for this player. So really having that interprofessional team is going to help to give you that individualized approach. And then lastly, I would say that if the student athlete continues to have symptoms with cognitive exertion in school, accommodations can also help to help with this. So increasing breaks between assignments, shorter assignments, providing a quiet room to finish assignments, and also avoiding noisy areas. So these are same can be also applied to athletics when we're talking about learning film, make shorter breaks during film time, going back to that learning style of making sure that athlete is actually getting the information in their preferred learning style. All of that is going to help with getting that athlete back. Coaches are going to say, wow, my athlete, and I think also it's important to take this information and translate it for sports performance, right? So the coach wants to know, I need my athlete to know the plays so we can win the championship, right? Well, this information can be translated to, yes, he needs to learn the plays. He needs to work on his memory. He needs to work on his reaction time. He needs to work on his focus and attention. He needs to all these things to make sure that he is a better athlete, but it's student athlete. That student athlete. He also has to do well in school to even play the sport.
Yes. Yeah, so don't make the mistake as the SLP. Don't talk about like learning the biology facts. The coach doesn't care about that. Yeah. Talk about the sports plays. That's
yes,
a great
example. Talk about winning. Talk about how you're going to get this player back to the field faster, right? How are you going to get this player to have good grades to be able to even stay on the team, right? What matters to everybody in sports is different.
That's wonderful. Thank you so much for sharing that example and like really helping us put ourselves in that perspective of how we can be part of the team with the coaching staff, with the athletic trainers. Athletic trainers, if you're listening, we're here for you. We can complement what we're doing. We are ready. So use us and we'll meet you too.
Yes. And I would say also, if you're looking for, just other opportunities outside of the clinic, serving on a board, serving in a community capacity, learning your community, learning to connect with other professionals in a different way than just the clinic is also important too. And I will even say that for speech pathologists, that it's not just all about assessment and treatment. It's, you can do other things outside of that.
That is so wonderful. Okay. We're wrapping up here. This has been a really enjoyable discussion. What final words of wisdom or inspiration would you like to leave with the audience today?
Head to speech. Ready, set, head to speech. I say that because we have the resources, we have the toolkits, we have the prehabilitation that's needed to really understand brain health from this perspective of integrating into what you're already doing, being part of your toolkit. And so some of the resources that we have at headtospeech.org, contact us, info@headtospeech.org, reach out to us, join our board, join our task force. We have an annual summit that actually takes you through everything that I pretty much talked to about today and more in more detail. And reach out to us because we have checklists. We have those toolkits that are going to help you say, hey, helping you assess what you have and what you're currently doing in your toolbox and how we can help you with your new toolbox, build your toolbox.
Wonderful. Thank you so much, Dr. Pope, for just helping us dream about like how to address a problem outside of what's even being done right now. You're a trailblazer. You're showing us the way and giving us new ideas, all for the clients who are not getting the services that they need. So thank you so much for your insight and clinical takeaways related to sports concussion management.
Thank you, Sarah. Thank you so much.
Thank you for tuning in to this episode of Speech Scope by MedBridge. Please be sure to subscribe and listen to more of our episodes on Spotify or on your favorite podcast platform and at medbridge.com. If you're listening outside of the MedBridge catalog and would like to access the bonus resources and receive continuing education credit, simply log into your MedBridge account and search for this episode to find the accreditation details. SpeechScope also listens to you. If there's a particular clinician that you'd like to hear from, or if you have a clinical question or challenge that you'd like to see addressed on this podcast, please let us know by leaving a comment on our Instagram posts or by emailing podcasts@medbridge.com.